Thank you, Tina, and welcome and good afternoon, everyone. Dr. Strang will now give us an update not only on the case from overnight, but overall where we are with COVID-19.
Thank you, Premier. Good afternoon, everybody. Today we're announcing an additional 31 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 293. There are currently 9 individuals in hospital. I need to correct that. Our news release said 10, but that was 10 people hospitalized overall. Today we have 9 people in hospital, and 64 have recovered, and their cases of COVID-19 are considered resolved. Yesterday we announced several options to expand our testing to help us better identify and respond to community spread. Today we're taking that one step further and removing travel as one of the screening requirements for assessment. Starting today, we'll be looking for any Nova Scotians who have developed fever or a new or worsening cough. Those are the symptoms that are predominant symptoms of COVID-19. And those are the people that we'll be looking to test to see if they have another virus or if they have COVID-19. So anybody concerned they may have those symptoms or other reasons they may think they may have COVID-19, we're asking if at all possible, go to the 811 website where there's a modified screening assessment that's there online, which will then direct them, if necessary, to call 811, who will do further screening and then direct them to their nearest assessment site to arrange testing. This is an important step. It means we're robustly now, we have removed travel. We know we have COVID-19 here in our communities. The vast majority of Nova Scotians remain well and unaffected, but we have to be looking for this disease in Nova Scotians, not just based on travel history anymore. To accommodate this, we have, as you've heard me say, we've continued to build capacity in the lab, and now the lab starting today is running 24/7 and will be able to process 1,000 tests a day. I do want to take a moment to thank my colleagues in the lab to do this. As you say, standing up an operation to run it 24/7 is no small task. I also want to thank my colleagues and co-workers in public health who are responding, working long hours to respond to this expanded testing capacity, the increasing number of cases that are coming in. They remain committed and professional in their work. Every single case is followed up in a timely manner. Contacts are identified, and we're still, everybody who's getting a test result, whether it's positive or negative, is getting a call back and a chance to hear from a voice and ask any questions. So I really want to thank my colleagues in public health for the work that they are doing as well. I'd like to turn to long-term care now. There are nearly 11,000 people working in the long-term care sector. They are caring professional people who are working extraordinarily hard in this challenging time. Their hard work is paying off. We fortunately have seen very few cases of COVID-19 in long-term care residents, and we are thankful for that and want to keep it that way. Today, I'm directing the province's 132 long-term care homes to follow certain measures to prevent the introduction of COVID-19 into their homes and to reduce the spread if it does get introduced into a facility. Licensed nursing homes and residential care facilities received this directive earlier today. The measures contained in the directive are effective immediately. They are based on and build upon the work that is done every year that public health supports long-term care facilities to respond to outbreaks of influenza and other respiratory diseases. But we're going one step further and making these a directive that is requiring long-term care facilities to take these steps. In summary, the long-term care homes are being asked to screen and staff and residents at least once a day, if not twice, and twice a day if it's operationally feasible. That includes monitoring of temperatures, and staff who come in to work at the start of their shift will be a quick screen of their health, as well as their temperature will be taken. We will continue to require the reporting of any respiratory illness to public health. Typically with influenza, it's 2 or more cases, but with COVID-19, we're saying one single case is potentially an outbreak, and that needs to be reported to public health. Any new admissions to a facility will require health screening to ensure that somebody hasn't been potentially exposed to COVID-19, and if they have, appropriate steps will be taken to isolate them. We have given clear direction on if there is a concern about COVID-19, clear direction and instructions for facilities about how they take the appropriate testing, as well as identifying potential contacts of any individuals, residents who are tested. And then there's comprehensive information there based on infection control and public health guidance for long-term care facilities to take in their areas of environmental cleaning, keeping line listing of individuals, cohorting individuals, groups of people together that help, that are standard measures for any respiratory illness outbreak. We're also asking in this directive, or we're not asking, we're directing that there's a reinforcement of physical distancing, enhanced cleaning, restrictions on visitors, etc. You may ask, why are we doing this now as a directive? I want people to know that this isn't new. It's not a surprise. We have been doing this, as I said, based on our experience with influenza. We have been doing this for COVID-19 for the last couple of weeks as our long-term care facilities became affected. But we now feel that we need to move this from a guideline that facilities are being asked to do to actually make it a very clear directive that is an expectation that all these long-term care facilities are required to take these steps to maximize the safety of their residents and to protect their healthcare workers. This is the next step we are doing to have things as safe as possible for the most vulnerable, some of the most vulnerable in our communities, which are our residents in our long-term care facilities. It's also the things that are going to help protect the healthcare workers who are still willing to go into work every day to provide the necessary care for those residents. As I mentioned previously, that in the last couple of days around a lot of discussion happening around the use of masks by the public, and there has now been some guidance provided by that overnight by the Public Health Agency of Canada. You may have heard Theresa Tam talking about this either last night or this morning. As we get more experience from around the world, it's clear that while the vast majority of people become infectious when they become symptomatic, and that is clearly the main driver of transmission of this disease, there certainly are some people who are what we're now calling pre-symptomatic. They're very, very mildly symptomatic. And they may not even recognize they're unwell, and we're often only identifying them when we go back and have public health follows up and has a detailed discussion with them. They go, yeah, you know what, I actually wasn't feeling quite so well back then. So we're calling them pre-symptomatic. And there also is evidence that people may be completely well, asymptomatic, and still be able to spread the virus in the 48 hours before they even start to feel unwell in any way. With this emerging evidence, there's now we come to a consensus among chief medical officers of health that the members of the public can wear a non-medical grade mask when they're out in public that may have some role in preventing the spread of COVID virus to others. It's important, a couple of points there. The evidence on this is not clear at all, but we felt there's enough suggestive evidence that this is something we can suggest to Canadians they need to do. We're not saying that every Canadian has to, but if Canadians feel, and Nova Scotians feel they want to do this, it is a small thing that they can do to help protect themselves and others. The role that masks can play would be decreasing their exposure, but even more importantly, it would be if they are one of these people who may be an asymptomatic or a pre-symptomatic transmitter, the mask will help prevent the spread of virus out of their nose and mouth and into the environment and others. It's important, a couple of things here that is critically important that the public understand this. We're talking about non-medical grade masks. It's critically important that the medical supply of masks and other personal protective equipment is maintained for the healthcare system and for other essential workers. The Public Health Agency of Canada, I learned this morning, is going to be coming out very soon with some online instructions that about people can make their own masks. So it's the type of masks where we're saying that people can choose to use out in the general public are non-medical grade or even homemade masks, and there'll be more information on how to do those over time. It's also critically important that people who choose to wear a mask, and these are probably most, where I would suggest where they're most valuable is in places where people maybe can't be sure that they're going to be able to maintain that social distancing. So if you go to a grocery store or going shopping, that may be the most appropriate place if you want to consider using a mask. But it's critically important that people don't get a false sense of assurance and then stop doing the good hand washing, the social distancing, all the other measures we're asking them to do. If you choose to use a mask, great, but don't let that stop you from doing all the necessary personal protective measures and the social distancing. And I'm going to end up by talking a little bit about the public health measures and provide a bit more clarity, some questions coming even from my comments that I made yesterday around driving in particular. I know that a lot of people are worried about COVID-19, and the vast majority of Nova Scotians want to do what we're asking them, telling them to do. They want to do their part. But I'm also hearing that my comments around driving, and even before that, some people may be afraid that they're missing medical appointments. They're not going to get their necessary prescriptions from a pharmacy because they're afraid of driving. They're afraid they might be fined. People need to understand that the police are not, if they see you out driving, they're not going to be stopping you and ask why you're driving. We're not ticketing people for driving. What we are asking people, like, it comes back to common sense. If you do need to make an essential trip, some people, including myself, drive in, have to go to work. That's fine. That's necessary. We also know people have to make essential shopping trips to get their groceries, get their pharmaceutical products, get money from the bank potentially. But what we are asking people to do is use those with common sense. Minimize the number of trips you make. Only have one person go shopping. But please, what I was asking yesterday was to not use driving as just a social occasion. But essential driving, essential trips, we recognize that's important and necessary.
Thank you, Dr. Strang. Last week, we announced 2 new programs to help those affected by COVID-19, the Small Business Impact Grant and the Workers Emergency Bridge Fund. People are working around the clock to ensure that the small businesses and workers can access those programs as quickly as possible. I'd hoped those things to be ready for today, but it's our goal over the next week to have all of the applications up and going by April 10th, this Friday. People will be working all weekend to process applications to get the money flowing as quickly as possible. The applications will be available online at novascotia.ca, and information about the programs will be available there as well. This is part of the next phase of our economic support, and we will continue to look at what the federal government is doing and consider how we best can complement those programs and support our most vulnerable Nova Scotians and businesses. And with that, we'll take questions.
Again, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have. We'll start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier, I believe you addressed this a bit on Friday, but just looking for some clarification. There are some folks concerned if they want to remove a family member from a long-term care facility, will they lose their spot after the 30-day period that's typically in place?
We, with the support of public health, are strongly encouraging Nova Scotians that the best place for their loved one is to remain in the healthcare facility that they're currently in. If you're in a long-term care facility, that means you require extra support to provide it there. One of the challenges is When you take a loved one out of the facility, we then would have to make sure that if they wanted to return, we'd have to isolate them, that they weren't bringing in COVID-19 into the facility. Adds tremendous amount of complications to it. But the department would work with every family if they thought the only option for them was to remove their loved one. We would work with them to see a transition back into the current facility that they're in. But I strongly want to emphasize the best place for your loved one is in the healthcare facility that's providing them the care. And every time someone is moved in or out of it, whether they're going home or from one facility to another, it runs the risk of bringing COVID-19 in to infect the rest of the facility.
Go ahead if you have a follow-up, Natasha.
I do. Premier, you spoke on Friday in Lent about people following the rules, about listening to police and following public health orders. And over the weekend, we saw dozens of people being ticketed for not following the rules. At this point in time, I mean, we're coming up to 300 cases. What else can be done for people to get the message, for people to stay home? Is there any other measures that your government can take?
Well, we'll look at all of the options. I will say this: more Nova Scotians are getting the message. While we are still frustrated, and I'm frustrated by those who continue to be reckless with our health by not following public health protocol. I will say that the vast majority of Nova Scotians are starting to recognize the importance of self-isolation and the 6-foot distance. We'll continue to work with them. Law enforcement will continue to be out across our province, but if things persist, particularly on some of our beaches and other parts, we'll continue to look at what other options and penalties we can do to put in place.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. Good afternoon, Premier and Dr. Strang. I'm not sure who could answer this question best, but as we're ramping up and the testing to go 24/7, and we're seeing these mobile units coming on board, I'm just wondering, with the testing capacity going up, how long will it be before we run out of supplies, or where are our supplies right now? I'm wondering where they're also coming from. I know New Brunswick is supposed to be getting a shipment today from the feds. And then we see an issue in Ontario. The Premier there saying they had issue getting some masks at the border. So I guess it just falls along that equipment side as we ramp up. What's their equipment stock looking like?
Do you want me to speak to the labs first? So I know that the lab is working very diligently. I asked them that question on an ongoing basis. Are we sure where are we at with supplies? And they continue to reassure me that they have the right level of supplies, that they have orders coming in. They're involved in through the National Microbiology Lab, working with all the labs in all the provinces and territories. One of the things they're looking at is making sure we're building capacity within Canada around the necessary reagents, et cetera, that are used for the laboratory testing, so we're not reliant on international product delivery. But I've been reassured that we continue to have plans in place to continue to obtain the necessary lab supplies.
And as far as the N95, the shields, the other surgical masks, garments, we have approximately a month's supply on hand. That's under using current protocols to deal with the pandemic. We have then another on-order supplies that will take us into the middle of May. It is our hope those orders will be here as quickly as possible. As you know, some issues happened in the United States yesterday, over the last few days. The decision by the national government of the United States didn't impact us directly. We have orders in other parts of the world, but that is an important supply chain as long as this will continue to go. But that is under current protocols. If those protocols are seen to change, that means obviously supplies disappears much quicker. And as you would have seen today, Ontario is talking about having 1 week at the height of their pandemic. We're working very hard to follow the advice of public health to ensure that we're providing support to our frontline healthcare workers.
Go ahead, Jesse, if you have a follow-up.
Thanks, Tina. I guess this more aligns with wondering when we're going to get this projection update this week that we said. I know, these are extraordinary times, and it's making our lives a lot different, and there's some uncertainty and people, I guess, knowledge is power. But for one, I guess, when are we going to get these projections? And Dr. Strang, I know it's not your name making these projections. I'm just wondering who is bringing this data together to give us this idea of where this virus is going, and how accurate can it be?
So there's a number of folks working in this in our analytics within the department, as well as within the health authority and the IWK. We've got some external folks who have quite frankly volunteered their time within their expertise to help this. I was involved in a meeting earlier today to understand that. It's going to be brought forward in the near future for the Premier's assessment, and then we'll move forward from there about how that continues to inform our response within the healthcare system, and how much of that that we then build into what we've already made known to the public.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Good afternoon. Dr. Strang, you told us yesterday that it's not okay to go to a drive for leisure. Obviously, you're saying that again today. But is this the point where we ought to look at closing more non-essential services like, for example, drive-thrus and shopping malls?
So that is something, as the Premier said earlier, all things are on the table, and we continue to look at where we could go next, including, like some other provinces have gone, to essential services. We don't believe we're at that point yet. We have to continue to look at the epidemiology, and if we compare ourselves to some other provinces, we're actually doing quite well in being able to start to flatten the curve. So we have those options on the table. Nothing's been removed. And we'll continue to assess the need for them as we start to move through in the next few weeks, and see what our epidemiology is showing us, and what the impact of our current strength of public health measures is actually having.
Go ahead, Shayna, if you have a follow-up.
Yes, I do. We're hearing from Nova Scotians who are worried that out-of-province visitors are still coming into the province. The conservation officers are staffing the border checkpoints. We understand they don't have the power to turn people away. So I'm wondering, how effective are the current measures to keep the province safe from out-of-province visitors?
So we're constantly analyzing that. We have seen a number of out-of-province people come home. We've also seen, and people are looking at other Canadian families coming to Nova Scotia to pick up their children who are going to university here. They come, they pick them up and take them directly back home. So it's hard for those who are seeing plates, believing those people are just coming to stay in our province. They're coming actually to do business, which means picking up their kids and taking them home. And in some cases, they are people who are coming home to their families and going to self-isolate. The biggest message that we're trying to impart to people as they come into our province, whether you're a visitor or whether you are a Nova Scotian, we expect you to self-isolate for 14 days. And if you're just coming here to socialize, we expect you to go home and do that in your main residence. But we're working and continue to analyze that. As recently as yesterday, we had an update, and we'll continue to monitor and watch that.
Next, we'll go to Michael Tutton from the Canadian Press. Go ahead, Mike.
Premier, transition homes for women who were in prison are full in Halifax. The Elizabeth Fry Society is asking the province if it could provide funding for a facility it would provide staff to house women, an extra home, during the pandemic, so that the danger to them in jails is reduced. Will your government seriously consider this proposal, which was sent on Thursday?
Yes.
Do you have a follow-up, Mike?
Why? Again, just please, I guess for my follow-up, please expand.
Of course we're going to, you asked me, would we seriously consider that proposal? Of course we are. This is a very vulnerable population. There's a tremendous amount of stress in households across the province. It's sad for me to have to say, as the Premier of this province, domestic violence happens in Nova Scotia, even without a pandemic. And now with the kind of pressure that this pandemic puts on families, it even makes it more difficult. We know that people are unemployed. People are having to make decisions about where they live based on their economic situation. All of those are factors that we're worried, quite frankly, about those women and children who find themselves in a violent situation. And I can tell you, we as a government will do everything we can to try to support our sister organizations out there who are really the lifeline for those families. Our most recent budget had those investments, but we know with this pandemic that we'll have to do more. And of course, we will look at that service. And I just want to say thank you to the frontline workers from all of our sister organizations who are at the end of the phone when the women and children in our province need someone, and when they come, their doors are opened, and we as a government will do what we can to support them.
Thanks, Mike. Next, we'll go to Cassandra Nadeau-Lamarche, Radio-Canada.
Hi, this is for Dr. Strang. So yesterday, it was announced that at-home testing could be done in HRM and CBRM with mobile testing units that were managed by trained paramedics. So why only those two municipalities, and how can people who live outside of the municipalities and cannot get to the assessment centers get access to testing?
So we built that starting to our two main population centers, HRM and Industrial Cape Breton. Where there are plans are actively working. EHS is working to develop that capacity for the other two health zones as well, covering the northern zone, western zone, and even into the Antigonish Strait area. We recognize that there's a need for this across the province as 811 and the assessment centers and public health work together to identify situations where the mobile testing may be necessary. We started where we have the greatest need, but we are continuing to build that so we have a provincial approach.
Go ahead, Cassandra, if you have a follow-up.
Yes, again for Dr. Strang. So we've seen over the weekend a surge of people being diagnosed, but we've also seen a surge of people being considered recovered. My question is, what is the criteria to be considered recovered? Do people have to get tested again, or is it just after a certain period of time that you're considered recovered?
No, we're following, this is a national consensus among the chief medical officers, the approach we're taking. If somebody is it's a minimum of 10 days from the time they became ill, but if they're at day 10 and they have no fever and their acute symptoms have resolved, they may still have some residual cough that's due to residual inflammation in their airways. But if they have no fever and their acute symptoms have resolved, at day 10 they can be considered now that they're free and they're a resolved case. If they still have fever or other acute symptoms, then we track them until those are resolved. And usually it's in that period between the day 10 to day 14. But it's based on resolution of fever and acute symptoms at a minimum of 10 days.
Next, we'll go to Marika Walsh from the Globe and Mail. Go ahead, Marika.
Hi, Premier. I'm wondering if you can tell me if the province has submitted a request through Ottawa's bulk purchasing for protective equipment for medical workers, and if those orders have already been fully fulfilled by Ottawa.
We have joined the national procurement process as a province, like all of the sister provinces have. Portions of that have been filled, but we've also been working other channels outside of the country, looking for our normal procurement that health would do, and then looking at other potential opportunities that have been brought our way.
Go ahead, Marika, with your follow-up.
Thank you. When you say portions have been filled, can you quantify that as a small amount right now from the feds? Or how much, like, is it a fifth, is it a half? How much has actually been fulfilled by Ottawa?
I don't know the exact amount. I can try to get that for you. We have someone doing procurement. I can tell you I was on the phone last week with the Prime Minister and premiers across the country, and I encouraged the national government to deal with Central Canada. We wanted to make sure that our order would be filled at the critical time for us, but as a Canadian, I'm watching what's happening in Central Canada. To our fellow citizens in desperate need of equipment today. And I said it last week on a call, and I'll say it again. The national government needs to ensure that where this pandemic is at its height, that they provide those supports. And the only assurance we need from them is that they continue to make sure that if it gets to the point where we need them that level, that they put the kind of emphasis on that's required. And we will continue, though, as I said, look for other avenues to find the protective equipment.
Next, we'll go to Daryl Cole from the Amherst News. Go ahead, Daryl.
Hello, Mr. Premier. I'm still getting a lot of reports from people in this area that a large number of people are coming in from other provinces or even as far as the United States. Last 24 hours or so, someone counted more than 60 vehicles from Ontario alone that have come through the border, as well as a number from the United States. Are people being asked the purpose for their visit to the province and turned away, or is everyone being let in with the warning that they need to self-isolate?
No, some have not been let in. You're coming in if you have purposes to come in for, whether it is family that you're coming here with. But as I said, there was a large number of out-of-province people coming in to pick up their children. We welcome about 20,000 young people to come here every year to go to school. 13,000 of them are other Canadian sons and daughters. We set an order out a few weeks ago for them to go home. That meant their families were coming to get them. As you know, there's very few airlines that are flying these days in and out of our province. And at the end of the school year, people have to come to pick up the belongings of their kids. So we have followed up on that. We've heard that. There are some coming in from other than Ontario. But the bulk would be coming in from Ontario that we're seeing, and there are a few from the U.S., but the vast majority of them are being stopped at the U.S. border, and the ones that are coming here have a reason to be here. Otherwise, we send them back.
Go ahead, Daryl, if you have a follow-up.
It seems we were sort of learning as we go along. Do you think there should be better coordination between provinces, such as between Nova Scotia and New Brunswick, on the rules?
Oh, I think that's life. We're learning as we go through this. This is uncharted waters for all of us. There's people out there calling this like SARS. This couldn't be further from different from SARS. So we're looking at the protocols that we've seen in other countries. And you think about the population of Canada and the size of this country. There's as many people or more living in New York than in our entire country. So what they're doing may not apply to Canada, and how do we as provincial governments continue to provide the supports? I can tell you, we looked at what was happening across Canada as this virus started moving its way towards this province. It's why we began to lock down pretty quickly. We closed bars and restaurants early in the onset for our province. Why we locked down our nursing homes the way we did to outside visitors. Those were lessons that we had learned from watching what was going on in not only Canada but other places. At the same time, and the issue of the border was the same as our airport. We had a lot of Nova Scotians who were coming home who had been away for March break, who had been down south at a place where they weren't taking this virus seriously. And we wanted them, as they landed at home, to understand the responsibility we saw for them to the rest of us. And we began very aggressively communicating to them at every entry point that we expect them to do self-isolation, but at the same time asking those questions. Why are you coming in? And after that, if you're coming in to pick up your children, we expect you to go do that directly and then go home. And if you have other business here, we need to know what that is, and you need to self-isolate if you're coming in here for a period of time.
Next, we'll go to Lindsay Armstrong from All Nova Scotia.
For the Premier, we're hearing from operators of private retirement homes who are trying to keep their residents safe by limiting outside visitors however they can. They would like to close their doors to external home care workers and provide those services in-house during the coronavirus pandemic. They can't because some residents rely on subsidized services. So I'm wondering, would the province consider expanding the home care subsidy program to cover private providers who aren't typically accredited so they can provide home care service internally for a period of time?
I don't know enough about that particular case, but there's obviously unique situations that are happening. I will ask Minister Delory, him and I have been separated. Really after the first week, he's at home self-isolating with his family. We're on the phone constantly. The reason for that is the same as I've been isolated from the Deputy Premier. If I happen to get sick, I need members of our government to be ready, but Minister Delory has been working from his home in Antigonish with public health, with his department, with his deputy, and I will take that request back and ask them to look into it.
Go ahead, Lindsay, if you have a follow-up.
Yes. For Dr. Strang, Ontario has said it's expecting the virus to hit its peak this week or next. New York has said this week will be its peak. About when will Nova Scotia hit its peak, and what will the weeks after the virus's peak look like?
So we're looking at the curve certainly in comparing ourselves to Ontario, BC, Alberta, Quebec. We're 2 to 3 weeks behind them and have been, and that remains the same. So we expect we're probably going to be getting our peak towards the end of April. I keep saying how big that peak is, and how dramatic it is. It's all up to us to do the things that we've been talking about every day at these briefings. What it looks like afterwards, you don't just come out of this quickly. So it somewhat depends on what it looks like afterwards about how severe that peak is. Again, if we limit that peak, we're in a better place to recover and recover faster than if we have a very dramatic and as a peak with severe impacts. I do want to make the point though that that you don't just turn the switch back on to life as normal after an event like this. We fully expect that with this wave, it's a full at least 8 to 10 week period, and that even though you had a peak, then you'll slowly decline from that peak with a lot of disease activity, but you can watch that carefully and slowly start to then loosen up some of the restrictive measures we have in place. But that doesn't happen quickly. In fact, lots of evidence. If you loosen up too quickly, then you're going to have the peak just coming right back at you again. So this is a longer-term issue, and that it's all based on a combination of strict public health measures, rapid, good testing for rapid follow-up of cases and their contacts. That's what works to minimize this, but it's not easy work, and there's no quick solutions here.
Next, we'll go to Kira McKenna from the Coast.
Hi there. I'm just wondering if we could get an update on the ventilator situation in the province. You said earlier there was 240. Do they all work? And how is the order of 140 more coming?
I don't have a detailed update on that. Maybe I'll take that back, and we can bring that forward in a subsequent briefing this week to get a more detailed discussion on our ventilator capacity.
But the 240 that we have in facilities are working. The question becomes, they'll get an update on the additional one, the additional ones for you.
Go ahead if you have a follow-up.
Perfect. And I'm just wondering, the current protocol we've been hearing from frontline healthcare workers doesn't have them wearing N95 masks all the time. How much of the current protocol is influenced by supply? And if we had more supply, would the protocol be to be wearing them all the time?
Well, first of all, your question is there's no protocol at all that would have frontline healthcare workers wearing N95 masks all the time. The evidence is very clear that N95 masks for this virus, which is droplet spread, it's not an airborne spread virus, so N95 masks are only necessary when there's certain procedures happening that could create aerosolized particles in the immediate surrounding around the patient. There is discussion going on about healthcare workers wearing a regular surgical mask. That continues to be looked at.
Next, we'll go to Adam Cook from the Little Community Television Channel. Go ahead. Adam, are you there? That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. I've talked a lot about isolation, the impact it can have on an individual. There's a group of special Nova Scotians I find myself worrying about. Many of these special people show up every day at our adult workshops or participate in our social enterprise programs. Some have intellectual or physical challenges, and yet they're among the most social Nova Scotians I know. If you ever visit, you will always get a big smile, a hug, or a high five. These special Nova Scotians are some of the most loving and kind people, and always open to making new friends or finding more friends. The daily interaction is about socializing and being together, and that has all changed. Many are now at home, isolated from all of their friends and their daily routine, and like everyone else in this province, they are having trouble understanding why. They are special Nova Scotians, and I consider many of them my friends. And I've called a number of them in the last couple of weeks. A lot of them don't like it, and they weren't shy about telling me. But they also told me that they are following the rules. And I am grateful that they are doing that because I know how hard it is. Perhaps the least we can do is follow their example. But also pick up the phone. Call one of your special friends. Ask them how they're doing. And let them know they may feel isolated, but they're not alone.